Hi, everyone. My name is Jaimie Wilkins, and I am going to be presenting my presentation on the impact of haptics by hospital caregivers on their patients. Um, this is my project that I worked on for the entire semester. So let's take a deep dive in and see what we can find out. So the first thing we're going to look at is we're going to look at basically an overview here, what we're going to discuss with this presentation. First of all, the introduction. We're also going to go through the concept and theory, the research Q&H, participants and designs, variables, survey materials, expected results, limitations, and future directions, all of which are very important. So let's start with our introduction. The use of touch by hospital caregivers is positively connected with patients' reports of well-being. The use of touch, or what we call haptics, allows for the caregiver to further establish that connection with the patient and show the patient that their caregiver does care about their well-being and their ultimate outcome. The end result is a better patient care and better results. So our concept in theory is human touch by a caregiver can greatly impact the patient in a positive manner and in a positive way, both emotionally and clinically in the treatment of the patient. According to a study that was done by Keltner in 2010, touch can signal safety, comfort, and trust with a patient. That same study also showed that the use of touch has been shown to calm cardiovascular stress by activating the body's vagus nerve and releasing the hormone oxytocin. Now, in regards to our research questions, so our Q1, that was, does the use of touch by hospital caregivers affect the patient's report of well-being? And our H, our hypothesis, is the use of touch by hospital caregivers is positively connected with patient reports of well-being. So let's take a look at our participants and our design. For participants, I have 5 sets of 2 patients having the same surgical procedure. Now, I would also pick procedures that are more common. For example, like a laparoscopic appendectomy, a laparoscopic cholangiogram, for example. So basically, that's gallbladder surgery and appendix surgery. Those definitely the more generic surgeries in regards to the category, and there's more of an abundance of them, which means we can find a better sample size uh, pool. So the sets of the patients would be similar in age and health. Also, their surgical procedures would be similar in the severity of their medical diagnosis. In other words, what I'm not going to do is put someone who needs to get their appendix out where it's not really hurting them but still needs to come out. I'm not going to match them up with a patient that is in the ED, and their appendix is burst, because obviously that's not an equal playing field. So that would be looked at as well. All sets of the patients would be surgery admit patients, so that would allow us for full monitoring post-surgical procedure. So let's look at the recruitments and incentives. Recruitments and incentives. The recruitment would result from surgical practices that are affiliated with the hospital system. That's just the easiest way to recruit patients. We would contact surgeons that do surgeries in their main operating room at the hospital facility, and get help with their help recruit appropriate patients. Due to the fact that this is a medical review, no monetary incentives would be given due to the current health care laws. That is very frowned upon. And also, I think it would impact the study as well. Consents would be signed for this research study would be signed by the nurses involved, the patients, and the surgeons, everybody involved. We would also comply with HIPAA as well, because that's, again, that's healthcare law. Again, the design is surgery admit patients having the same procedure. One patient would be given the haptics therapy post-surgically, and one would not be given the haptics therapy post-surgery. Patients monitored and progress would be recorded. What's great about this is that we're able to use the EMR, which is the medical records, and we're able to view what exactly is going on, and we can track the success, the results by their vitals, everything imaginable. It's all going to be there. So that's going to be really great for us as far as gathering our data, which we'll do after the study is ended. Also, there will be a patient survey at the end when the patient is discharged, and that would go in addition to the research that we've already collected. So our dependent variable is the surgery admit patient being used for the study. The independent variable is the care that is given to each surgical admit patient. Again, our expected results, the use of haptics in patient care does have a positive impact on patient overall care. The use of touch or haptics allows the caregiver to further establish that connection with the patient and show the patient that caregivers care about the patient and their outcome. Also, surgical procedure results will greatly improve with better patient outcome and satisfaction for the patients given the haptics therapy. So we do have some clinical care results. This is basically a breakdown between haptic patients and non-haptic patient results. And you can see where the haptic patients did a lot better than the non-haptic patients. And you can also see that the patient satisfaction surgery, again, the haptic patients felt far more satisfied and gave a much better patient satisfaction report. Limitations, well, we definitely do have some limitations. During a patient stay in a 24-hour setting, multiple nurses would be used, concerns that equal quality of technique would be used. That's a fair statement. If you're getting multiple nurses, it might be difficult to get that same level of care with every nurse. Also, the human body is unique in that while the same care is given surgically, one body may randomly react poorly due to just the nature of that person's body, regardless of haptics or medicine in general. It would be difficult to get patients to sign up for the study or experiment due to not knowing who would get the treatment and who would not. Future directions, I think it would be great for us to look at a larger scale of patients. We only did 10 patients, which is it's a pretty small sample size, but you know what? It's a good start, but a larger sample size would be needed. This research project would have to be done in other geographical areas to see if there's a difference in location with results. And also cross-cultural demographics would have to be explored to see if one specific demographic does better than the other or if it matters at all in the overall outcome. So that is my presentation. So thank you for allowing me to present that. And my name is Jaimie Wilkins. I am a professional communications major and a consultant. Any questions, feel free to drop me an email.